an embryo transfer, they're usually told to test 11 days after their transfer, with the day of their transfer being day 0. So we tell them to call us whether their result is positive or negative, because we will have some information for them. We're very delighted when we get patients calling us that say that they have had a positive result, and usually that's a really nice phone call and you get to congratulate your patient. Those phone calls, they brighten up my day. I really, really love those phone calls. The fourth thing that we want to see is a gestational sac. We then want to see something that's called the yolk sac. That's what will continue to feed it until the placenta takes over. If we see a gestational sac, it means that the embryo has in fact implanted. I think sometimes when you're trying to show empathy towards someone, we always say, oh, I understand, or I know how you feel. I steer clear of those words because personally, I actually don't know how they're feeling. I don't understand. I would say go for it. Absolutely go for it. Don't be afraid to enter the clinic. Don't be afraid to ask questions. I think as well, a lot of people take what their doctors say as gospel. And while we work with a lot of amazing doctors, I think it's okay to be challenged sometimes and to say, oh, I've heard of this. Would you like to try this treatment? Or I've heard of this protocol. Maybe we could try this protocol.
Welcome back, Lauren, to another episode of Let's Talk Embryology. Thank you for doing this again. We really enjoyed the first part where you talked about what actually happens on a day-to-day basis in the theaters and how you assist patients. Now we'll talk more about what happens after the procedure, how you follow up patients throughout their pregnancy, and also try to understand the mental support that you provide to patients. So my first question today, can you tell us what actually happens after the procedure? After, as in not immediately the same day, but since patients have to follow up through their pregnancy, what does that journey look like for patients?
So when they will be told that they will test, so for an embryo transfer, they're usually told to test 11 days after their transfer, with the day of their transfer being day 0. So we tell them to call us whether their result is positive or negative, because we will have some information for them. Obviously, we're very delighted when we get patients calling us that say that they have had a positive result, and usually that's a really nice phone call and you get to congratulate your patient. And yeah, I just really, those phone calls, they brighten up my day. I really, really love those phone calls. However, there also is the downside that the transfer may not work. And this part can be really stressful for the patient, especially because sometimes it could be their last embryo. So they either have to decide, do they want to go through the whole process again, or have they decided that they will stop treatment? So this time can be very upsetting for patients and emotions can run really, really high. And we just have to offer them as much support as we can give them. We do have a counsellor that we can offer them services to. And just we also have an emotional support team at our clinic that can reach out to patients and can send them links as to where to get. So maybe some free counselling if that's the case that it's needed. Or if they just need a chat, sometimes they just need to vent. And that's what we're there for as well.
Right. And when the patients are at the clinic for a scan after getting a positive pregnancy test, what do you look out for on the scan? What are the signs that you keep an eye on?
So we want to look out for, the first thing that we want to see is a gestational sac. If we see a gestational sac, it means that the embryo has in fact implanted. We see a gestational sac. We then want to see something that's called the yolk sac. The yolk sac is, we call it the lunchbox. And that's where it keeps the nutrients for the embryo. That's what will continue to feed it until the placenta takes over. So we want to check for the gestational sac, the yolk sac, and then we also want to see that there is in fact an embryo inside that gestational sac. If there is an embryo inside, we will then want to check to make sure that it actually has a heartbeat. Sometimes patients can get scanned a little bit earlier. So sometimes they may get scanned at 6 weeks. Technically, they would be 6 weeks pregnant. We also take into the account the age of the embryo. So typically the embryos will be day 5 or day 6 embryos that are being implanted. So we do take that time into account as well. So sometimes if they're getting scanned at 6 weeks, we also like to tell the patient that sometimes it actually might be too early to see a heartbeat. So it's all about managing patients' expectations, because if they're coming to that scan thinking that they're going to see a heartbeat and they don't, they automatically will panic and will stress,
Right.
even though we know as clinicians and as a medical team that sometimes this isn't the case if you're having a scan early on. So if you see a heartbeat, that's great. We will let the patient that we know that we can see a heartbeat. We want to measure that heartbeat. I don't know the numbers off the top of my head, but we do want the heartbeat to be typically higher. We want it to be, I think it's roughly over 120 beats per minute.
Oh wow,
It sounds very,
that's quite high, isn't it?
yeah, it sounds very, very high, and it doesn't mean that anything is wrong. Just typically when things are smaller, so like an embryo, which is teeny, teeny, tiny, heartbeats tend to be that bit faster. So we
Right.
look for the heartbeat, and we'll also measure the embryo itself from top to bottom. When we measure the embryo from top to bottom, the computer will then give us an analysis as to how many weeks and how many days the embryo is measuring. I believe it's between 5 and 7 days. If it's measuring out of between 5 to 7 days, that would be considered normal, and there wouldn't be anything to be worried about. But however, if it is measuring more than a week behind, then sometimes we will offer patients to come back for a reassurance scan the following week. If we find that the embryo is still not progressing, we then may refer them to an early pregnancy unit. We are a very equipped clinic. However, we are limited as to what we can and can't do because we aren't a full medical setting. And we
Right.
tend to deal with the first early stages of pregnancy rather than the latter. So, as the pregnancy continues to progress, if there are any issues, we then typically refer them to the early pregnancy unit.
Right. And so you do a scan to check if there's a heartbeat, but after that, to monitor the pregnancy further, do you do any kind of scans as well at the clinic?
No, so we are actually only licensed to scan, I believe it's up to 10 weeks at our clinic. So after they are 10 weeks, they then will be referred onto their midwife. They will do a self referral to whatever hospital they choose, and they will be looked after from then. We always tell patients that we are happy to receive messages from them, because sometimes they may not know where to go to look for this help or to look for that support if it's needed. And so we always just tell them that they're more than welcome to contact us. However, they need to be aware that we may not be able to scan them. We'll only be able to provide certain information.
Right, right. I imagine not all scans would be a positive ones. There might be a lot of negative scans as well, as in you don't see any heartbeat or the pregnancy is not going as expected. And understandably, in that cases, patients might be quite upset. They might be
Yeah,
sad. They might
sometimes
sometimes be angry as well. So how do you speak to those patients? How do you deal with their how do you provide a mental support to them?
I I feel like I have to be very careful with my words at this time. Emotions are really, really high, and I think sometimes when you're trying to to show empathy towards someone, we always say, "Oh, I understand," or "I know how you feel." I steer clear of those words because personally, I actually don't know how they're feeling. I don't understand. I just say to them that I confirm to them that what they're feeling is valid, that it's okay to be angry, it's okay to be sad, that if anything, letting those emotions out will actually help them move forward in their process rather than just staying. If you hold it, I always say, if you hold it in, it stays there. If you let it out, it's gone. So just trying to create that safe environment for patients to know that it is okay to cry and it is okay to be angry. We then, sometimes with patients, you may want to offer a hug. And sometimes just as simple as a hug can mean so much to a patient. A lot of the time, patients come by themselves. They might not come with their partners because of work commitments. Fertility treatment is very, very taxing on your day-to-day life. And you have lots of appointments, and sometimes your partner may not, or you might not have anyone to come with you. So just offering that support, whether it's holding their hand, offering them a hug if they would like it, offering them a quiet space just to cry by themselves afterwards, bringing them a cup of tea, some water. It sounds like such little things, but I know because patients have told me that they actually really, really appreciate those small gestures in order to help them feel supported and okay.
Right, right. Like you said, it's just a big wave of emotions. You have mixed emotions.
Exactly.
You're frustrated, angry, maybe irritated, sad, all at the same time. But especially you
Mhm.
can speak with patients when they are sad, and like you said, you offer a hug or provide them with soothing mental support words. But if patients are angry as well, not personally against you, but just at the overall situation, and sometimes I think patients might be getting angry towards you. So how have you seen that happening towards your first question? And the second question is,
Um,
how do you deal with it?
Many a times I've actually seen that, unfortunately, and I try not to take it personally because I have to remember that not only is this person going through a horrible experience, they're also likely to be on certain medications which are pumping hormones into their body. So sometimes their emotions are not their own. They wouldn't actually typically react like that. So you just have to take that into account and be like, this is not really how this person is on a day-to-day basis. It's the medication that's talking. That's what I usually say to patients.
Yeah, that's
It's the
true.
medication that's talking. And yeah,
Yeah.
obviously, if it's a certain situation where I feel things are getting very aggressive and patients start to raise their voice, I just ask them calmly, please don't raise your voice. I understand that you're upset. I understand that you're angry. How can we talk about this? How can we rectify this? What can I do to help you feel supported in order to de-escalate this situation? So I think it's always bringing it back to the patient to ask them what they want and what they need, because you may not know. You may have tried all of the other avenues, offer a hug, offer a handhold, offer some kind words, and they may not have worked. So sometimes you just ask the patient, what is it that you want? And if I can, I will do that.
Yeah, makes sense. Yeah. There's only so much you can do. You can provide all the support you can, but there's some things that you just can't change no matter what. Yeah,
Exactly.
that's true. So you described a lot of what happens in the theater and during the scans and also after the scans, how you provide mental support. But coming to your own career, do you have any future plans after this? Do you want to study more? Do you want to do any other course, any certification, anything on your mind?
Yeah, I would actually love to go back and complete my nursing degree. So I'm a healthcare assistant at the moment, which in a fertility clinic, their jobs are very, very similar. I would say that some of the things that nurses do that I don't would be like hand out medication and stuff like that, and injection teachers and things like that. So it's not very different. However, I just find for progression in my career, and wanting to be able to transvaginal scan at clinics. Although some I have done it at previous clinics, the clinic that I'm at now, they just prefer their nurses and their doctors to do it, which is absolutely fine. The clinic that I'm at now is definitely where I want to stay for the future. So I would do any course that they want to send me on, really. Anything that will help me with my career. I would love to go back to study nursing full time, but time is ticking on.
Yeah, yeah,
I'm nearly 30 this year, so I think it just depends on if I get that opportunity. If I do, great. If I don't, I'm very happy where I am.
yeah, right. Yeah, makes sense. With your current experience in this field and going forward with the AI and other technology that's developing so fast, do you see any procedures or any bits in your job that could change significantly later on in future?
I would say in terms of AI and like technical advances, I don't think that will affect my job per se. I think the roles that I have and the duties that I have do need to be done by a human person. However, I do know that things in the lab side, like embryology selection and things like that, I do know that there is some advances at the minute with AI, and I do think that they will continue to develop in terms of the embryology side.
Right, makes sense. I think for as a nurse, as a HCA, you need a physical person, actual person, than being dependent on some kind of machine.
Yeah.
Yeah, makes sense. And also because I think your role is much more patient facing,
Yes.
So you have to talk to patients a lot, understand their state of mind, which I don't think any machine or any technology would be yet
Yeah, I don't think
equipped to do.
I
Yeah.
yeah, I don't think that that's a great approach, and I don't think that my clinic would appreciate that approach. I think to try and make every patient feel like they're the only patient you're looking after, that's our goal. And I don't think that with AI, I don't think that patients will feel that.
Yeah. It will just feel unnatural because there's no
Yeah.
actual human in there. Yeah. Right. And just a few other questions. So if not HCA as a nurse, what else would you be doing?
To be honest, I think I was born for this job. Everyone in my family works in healthcare, so it's all I've ever known. Um, I really like working with people. So if I wasn't maybe a healthcare assistant or in the nursing field, maybe I would be a teacher.
Right.
I like to
Okay.
share information. I like to make people feel supported. And I also loved my school years as well. And I
Uh-huh.
found that certain teachers really shaped who I was as a person. And your school years, although people may not think it, they actually do shape you into an adult in certain aspects. So I think, yeah, I would probably like to be a teacher to offer that support and to hopefully be that support for someone else like my teachers were for me.
Right. Yeah, makes sense. You'll be a good teacher. You will explain a lot, I think,
Thank you.
in great detail and also in very, very nice way. So you have those teacher skills, I'm sure.
Thank you.
There'll be a lot of patients um, or who are not pa yet patient, but they're thinking of going into IVF treatment. Is there any message that you would like to give to those people?
I would say go for it. Absolutely go for it. Don't be afraid to enter the clinic. Don't be afraid to ask questions. I think as well, a lot of people take what their doctors say as gospel. And while we work with a lot of amazing doctors, I think it's okay to be challenged sometimes and to say, oh, I've heard of this. Would you like to try this treatment? Or I've heard of this protocol. Maybe we could try this protocol. I think the world of fertility is developing every day in terms of medications, treatment plans, and stuff like that. So a lot of patients come in thinking that what they've been told is what they have to do. Where if they ask, if you don't ask, you don't get, is what I always say to patients as well.
Yeah,
But yeah,
makes
I
sense.
would say
Yeah,
go for it. You're taking control of your body. Although you may not want to be here, I understand. Yeah, you just take control and do what's best for you.
yeah, right. Any advice for aspiring healthcare assistants? Or on top of advice, is there anything that you could have done differently in your career, which you think now people who are getting into this career should do for better outcome?
I don't think that I would do anything differently. I think that the way I've progressed has been a good enough way that I don't feel like I've rushed. I feel very confident in the things that I do and the duties that I do in the clinic. So I would say that just take your time. Patience is key. Don't feel like you're not going to get everything straight off, and that's okay. Don't be afraid to ask for help and try fertility if you like it. If you like it, you'll never leave.
Yeah, it's such an interesting field. I agree.
It's a very
Once you're into
rewarding
that,
job.
yeah, yeah, that's true. With a lot of emotions involved, you get the satisfaction out of your job, I'm sure.
100%, yeah.
Last question for you. How would you describe embryology, IVF, or fertility science in one word?
Magic.
Magic, right? It is
Magic.
magic, definitely.
Because although it's scientific and I know the science behind it,
Yeah,
sometimes patients come in with the lowest odds, everything against them, and they still get pregnant. And I just think it's absolute magic.
that's true. Yeah, it is magical. It's such a fascinating science behind all of this, and you wouldn't imagine you could do so many so many things with this
I know.
fertility science. It's purely magic. I agree.
Yeah.
Well, that's it for our both parts with Lauren. I'm sure everyone, whether they be patients or students or even the current healthcare assistants working in this field had something to gain out of these 2 episodes. If you have more questions, you can ask us on our LinkedIn. I will provide both of our LinkedIn handles in the description below. You can directly text us if any questions, or even text us in the comment box. Thank you so much, Lauren. Thank you for doing both the parts. Thank you for your time.
My
I hope you
pleasure.
had a great time.
I did. I really enjoyed it. Thanks for letting me share my experience.
Perfect. All the best for you. Thank you so much.
Take care. Bye bye.
Bye.